registered, and I'm not sure if people are having trouble getting on because people are bouncing on and off really rapidly, but I'm going to get started, and hopefully a few more people will be able to join us. All right. I wanted to start with just a few slides on data and what's happening both nationally and locally in our states. Let me get my, hold on, get my thing to advance here. Okay. This is just a different way of looking at some national data. This is from the Center for Systems and Science and Engineering at Johns Hopkins University. And basically it's showing that, as we all know, that cases are increasing around the country as they are around the world, both in number of cases and in deaths. This is some 7-day averages for the last 3 weeks, and as you can see, they're increasing in both of them. I have read that death rates are going down, that people are getting better at treating COVID, and so the death rate is dropping, but we still are seeing a large number of deaths, especially across the South. This slide on the picture on the right is how different states have changed over the last several weeks. And I think as we keep talking about how to figure out whether or not we're in an outbreak or trying to assess risk for ourselves and risk for our panels, I think this kind of data is helpful to look at from a statewide level, just as what direction things are headed in. Vermont, as you can see, is gray, and I believe that's because we just don't have enough numbers to really count or to really calculate. If you look at some of the maps, we've had over 50% increase in cases, and that basically means we've gone from 6 to 9. So Vermont is in a pretty good place. Other states, as you can see on this chart, are not so much, especially like Florida and California have huge increases in the number of cases. So that's kind of a national picture. Certainly that is likely to affect us both in Vermont, Minnesota, and Rhode Island, because people move around a lot, and with schools reopening, people, and at least here in Vermont, with leaf peeping season ahead of us, people moving into our area is certainly a concern. I wanted to share, and this is, I apologize, this is very Vermont specific, but on the Vermont Department of Health, they have a page where you can look at how many positive cases there have been in the last 2 weeks. And I particularly find this information really helpful when thinking about our panels and what our risk is. It doesn't break it down to the town level, but if you were going to be traveling, for example, to a panel in Newport, Vermont, we could look and say, oh, there has been 0 positive cases in the last 2 weeks in Newport. And there, by comparing it, the smaller picture over on the right is from 2 days ago, and this one, the bigger picture, is from today. So just a way of looking at your county and whether how many cases there are in your county in the last 2 weeks. I think a lot of the information we look at gives us a grand total, and that isn't just particularly helpful since this has been going on now for 4 months. We don't know how much of it's recent growth and how much of it's old growth in cases. So this is on the Vermont Department of Health website. The initial page will show you total county data, and then if you click on the little arrow, which is right here, it'll take you to recent cases. So I think this one is kind of helpful. Okay. And then I wanted to share some national statistics. I know we've talked about this quite a bit, but in the 10 weeks, this is from the CDC data of what was happening in emergency departments in March and in April. and this has been talked about quite a bit in the news about emergency departments declining significantly. And I think that this second chart where it's showing a decrease in the number of people who came in for heart attacks, strokes, and high blood sugar is particularly concerning. That obviously people haven't stopped having heart attacks, strokes, or uncontrolled high blood sugar, but they were not seeking emergency care during that time. So definitely something that we need to be thinking about as we move forward, and if we go back into an emergency situation here in Vermont, and I'm not sure if this is still holding in other places like in Minnesota, where there still is a lot of cases, if people are still hesitant to seek out care. I'm going to stop and see if there's any chats on that. Feel free to chat in any comments or questions. And then I had one final slide to share with some of our more local or more SASH-specific data. And this, again, is at least the first one, and the last one is Vermont specific. The PHL data is statewide, or includes Minnesota and Rhode Island. And we're just starting to look a little bit at this, and with some concerns around, are our SASH participants also not seeking care when they should? And the ping data is definitely concerning. None of this is super specific. For example, we've gone in the same time period in 2019, there was 11 deaths recorded in ping. We did add an additional hospital in the fall of 2019, so that probably contributed to some of this increase. But there was a lot more deaths in the same time period this year as compared to last year. And according to what we know, there's only been one SASH participant that passed away from COVID-19. So are these collateral deaths? Are these deaths from COVID-19 that was undiagnosed? There's certainly a lot of questions, but it also brings up some concerns about our participants not seeking the care that they need. So as I want to now switch to letting you guys check in, but I wanted to share this data with you because one of my questions for you is if you're seeing any trends on your panel. Are you seeing increases in severity of illness? Are you seeing, have you seen more deaths in your participants than you would have expected during this time? And just as a way to kind of shape the SASH policy and what we're doing moving forward, what it might look like in the fall, and where the risks are to participants. There is some chat, but I think that's not related to what we're, okay. Okay. So some reflective questions for you guys. The second one is, have there been more deaths or negative collateral damage to participants in your panel that you feel is due to the lack of healthcare access? I'd definitely like to hear more about that. Had some questions from implementation managers about how nurses are working with their SASH coordinators right now. Are you in the same office? Are you doing any visits together? How is that working, and how are you figuring that out? And then the main question I keep pushing the nurses in decision making and in our phased approach. I keep saying, use your nursing judgment. We're professionals. We're trained in risk, in PPE. So use your judgment. And I just wanted some feedback from all of you about what that means to you and how comfortable you are with assessing your own risk and the risk to your participants when you're visiting them. How confident you feel in being asked to just use your own judgment, or do you need more guidance or less guidance? Are people looking to you for guidance? So certainly feel free to bring up any other concerns or anything else you want to talk about as well. Those were just what I had on my mind as things I would love to hear about from all of you. So I'm going to start with Melissa Stockholm because I know she has to leave soon. So Melissa, can you let us know how things are going there?
Yep. Hi, everyone. I'm going to make it kind of quick because I got to go in just a couple minutes. I'm down in Addison County in Vermont, working in 4 panels. So I work with 4 different SASH coordinators. And how we're working is we talk to each other on the phone on the day that I'm at that site. And then we email back and forth during the week, and sometimes call each other during the week as well. We're not staying in the same office, and we're able to do that in Virgins and one of our Middlebury sites. I am in one remote site, so we're obviously working separately, or community site, I mean. And then in another site, I can work in another room. So we are trying to stay apart. We're in phase 2, looking at going into phase 3 starting August 1st because I'm on vacation next week. First day off since Christmas. We just had something happen yesterday morning or Monday morning that both the SASH coordinator and I are pretty upset about, and it would reflect, I think, on social isolation. Down in Shoreham, there was a house explosion, and it turned out to be one of our SASH participants. And the article in the paper, the investigators believe that it might have been suicide. This participant lost his wife a year ago. He was a highly anxious man. He was new on our SASH panel as of February, so I did my initial visit there with him. I think I saw him one other time, and then we've been on the phone with him. And Anne, our SASH coordinator, has made 3 food drops to him. But yeah, he looks like there were 4 small camp propane canisters that he might have lit. He left his car title and the keys, or I guess the house title and some pertinent information outside the house. So that's leading the investigators to believe it might be suicide, but we're pretty upset about that. I'm seeing, we've got another person who I'm going in to do some blood pressure checks. And I think the stress of all this is increasing his blood pressure. We're not sure if it's that or that he has telehealth in now. Definitely seeing some, effect of people that actually are staying home more than normal. I'm not giving you any nursing judgment because I really got to get going, but that it's just a little quick update on what we're doing with SASH coordinator.
Thank you, Melissa. And so sorry to hear about the loss of your participant.
Oh, thank you. That's hard. Yeah.
Yeah.
Mm.
Yeah.
Okay.
Yep. Yeah. Please reach out if you guys need to decompress or talk about that at all.
All right. We'll do, Casey. Thank you.
All right. Thank you. Just see who. Catherine and Judy, I know you're both on the same line. You want to give us an update on how things are in Minnesota?
Judy, do you want to go ahead? I don't know if Judy's connected. I think she had a hard time connecting too, as did I. The link on the thing wasn't working. Oh, you are. Go ahead. I'll let you go.
I am here. Sorry, I'm impostering as Kathy because I had to use her link to sign in. I couldn't find that I got confirmation. I didn't know it came up as the name. So sorry about that. I think, we're still not open a whole ton yet here in Minnesota. We're just talking about potentially, at least in some of the sites, kind of going back to being at more than one site. That's kind of in the works, and I know that Kathy can talk a little bit more about the non-PHS sites, but there's still debate as to whether once we are back fully on the sites, if we'll actually be going into apartments or doing any kind of hands-on thing. I think that's all in the next week or two, kind of trying to be settled out, but we haven't started any blood pressure clinics or any group activities or anything like that. So I feel like, at least compared to Vermont, we're just kind of starting to get our feet back on the ground, and most of everything has been phone visits. Once we are back on site, it sounds like we will not be able to be in the same office at the same time. So we are going to be switching our days around so that only either the nurse or the SASH coordinator is in the office on any particular day, so we're not sharing that space. Kathy, you can continue with anything that I've omitted.
Sure. And part of that is the space that we have is not enough to social distance, even if SASH coordinator and wellness nurse could be there, at least for, each of us. Judy and I, as nurses, we each have 2 different coordinators that we work with, so we do a lot of juggling back and forth. So, but yeah, I know that I'm at one site out of my 3 sites, and I am seeing people, but not in their apartment. I'm mostly doing phone, but it is nice at that one site to be able to briefly visit with people, masked and social distance, of course, and reassessments are going well. We're doing some new assessments as well over the phone, and I think all things considered are going quite well. And like Judy said, I think some things are unfolding likely in between this week and the next 3 weeks as far as different direction on certain things that we're just kind of waiting from up above for direction and approval and things as far as where we can go, when we can go, and how we do that. So kind of big transition, but we're still plugging away as usual, and things are going well. And our participants, to my knowledge, none of our SASH participants have COVID, but we're spending a lot of time with them on the phone, and I think we're meeting a lot of needs, which is good.
Great, thank you, Kathy and Judy. I am curious if, as you guys are trying to make these decisions on how to move forward or move into the next phase, is your team seeking your judgment as nurses? Are they, are they seeking you out in that way, or is your role are you more waiting for them to kind of come up with what they want you to do, and they're getting their guidance from elsewhere?
I feel like PHS is really kind of taking the lead on all of this. With 40 plus sites across the state, I think they're just trying to keep everything consistent. And I wouldn't say that we've really been asked our opinion on when and where to kind of step back in. I think they're just kind of making the decisions from the top down, between the assisted livings and the long-term cares, and with our outside home care agencies, just trying to figure out who's going to do what when. So I wouldn't say that we probably have much influences to what we're doing.
But we are able to voice what we think we need if and when that time comes. We've been able to tell, Hannah what we will need and when and all that kind of stuff. So I think as a SASH team, we're working really well on all that. But yeah, above the 5 of us, then we kind of have to wait and see, because we're a tiny little program compared to all PHS and all the care that's provided.
Sure, yeah, and that does make sense. And I think that what you may find as you start to be back in there, that the kind of judgment questions that I think have been challenging for some of the Vermont nurses have been a lot more of the kind of nuanced, how long do I stay in once I'm allowed in? Is it 5 minutes? Is it 10 minutes? Is it 15 minutes? And those kinds of nuances that may not get dictated from the top down. So I definitely look forward to hearing more next time on how things are going with all of that. Let's see. Kathy Schuster, are you able to tell us how things are going there? Kathy, you're self-muted, I think.
Yeah,
Are you
she
able
is
to
self-muted.
Are you able to unmute Kathy and let us know how things are going? I'm going to come back to you. Sarah, are you able to let us know how things are going there?
We can hear you, Sarah.
Can you hear me?
Yeah.
Okay. Sorry, rumbling around. Okay. So I am at 2 different sites in Burlington. One's in South Burlington, one's off the new North End, North Avenue. And on one site, I am there 1 day a week. And so I do see a coordinator. We're in completely separate offices. But mostly it's still by phone or email that I work with the coordinators. Coordinator and I did do a joint wellness visit the other day at Grandway. And I had to kind of think about that before we were going up. I think the coordinator was more like, let's just go. And I'm like, wait, let me think about this for a minute. And sort of, we got information from another resident on this person that they were disorientated. So this is kind of like nursing judgment too here, but they were disorientated, like we're looking for their phone and it was sitting right there. There's one other thing that they said, just a little bit confused. And so I said, okay, like, let me try giving this person a call first. And so I made that judgment. I called them. This person is actually from another country, and it was hard for me to kind of understand what was going on. And so I said, okay, yes, let's go up. So whenever I do any apartment visits, I do wear mask and face shield and gloves. So I just to be extra safe when I'm going in their house, I don't know what I'm going to find. We aren't able to screen this person. So it ends up she was not there, and she was actually up at the hospital at an appointment, and she was fine. So, it's hard to tell when you get reports, from other people, like what's really going on. And you always, want to respond and make sure they're okay. But it was just an interesting situation. And I definitely, kind of took that pause, and I was trying to think of all the factors there of like, this could be very urgent, and like, what about COVID, what PPE, so, that was kind of an interesting situation. Glad she's okay. And so I guess the next question is to the deaths. There was definitely one that I feel like was due to lack of healthcare access. Still don't know the cause of death, but this person was found in their apartment, and they have, some chronic health conditions, including diabetes. They were going to adult day every day of the week. No longer were going. Their case manager from Howard Mental Health was not able to see them either. Like no one was going in, and this person was administering their own insulin, which they don't normally do. So again, I don't know. I still don't know what happened and the cause of death, but I really feel like that probably wouldn't have happened if they were going to adult day and getting sort of that nurse doing managing their meds and getting that sort of oversight and, eyes on assessment on that amount of time. So that was really sad and hard. There have been a couple other deaths too at the site at Grandway, but not related that I feel like to COVID. So nurse judgment, what does that mean to you? So I think it's taking all the information kind of at hand, objective, subjective, and determining which action to take based on that information. And then how are you assessing your own risk? So there's so much information, and I feel like, Casey has given us, some pointers, and there's the Vermont Department of Health and CDC. I think I usually take the extra step of being cautious to protect myself and others. And yeah, I don't know. So I guess I just choose to maybe do a little extra PPE. I do wear, if they, I always wear a face mask, including a mask if they don't have a mask. And whenever I go in apartments, I always wear a face shield. Did I say face shield? Face shield and mask. Face shield and mask and gloves in an apartment. Yeah, I guess, it's been a little bit hard, limiting the amount of time sometimes with people, or like the other day, there was someone who, I screened her and with the questions before I met with her. And then she came down and she said, well, I do have these sinus symptoms, and some of it's normal and I have it. And then, but this is what's happening. And it didn't sound, like really concerning, but I was like, oh my gosh, and it's just, there is, like you're saying, Casey, all these like little things that sort of come up, and like, how do you deal with it? And I did actually put my face shield on, but it's hard to wear that. It's hot. It's like this other barrier. They can't hear you anyways through the mask. So it's awkward. It's very awkward to wear that, but I feel like, I'd rather be kind of safe and choose that. So how confident are you in your own judgment? I kind of feel like as a SASH nurse, you have to be, because there's no one else to like sort of consult with a lot of times. So you just have to kind of learn to trust yourself, and then check with, other nurses as you can. But I think that's kind of how I go about it. And the more guidance, I think what I'm thinking about here is, how to stay updated on the recommendations for PPE. Now, you talked about, Casey, the aerosolization of COVID and sort of more evidence maybe coming out to support that. So then what and if, that's true, are the PPE guidance, what is the PPE guidance around that? And one resource I think is a great place to connect to is local home health agencies. They seem to sort of have this very clear protocols and changing protocols based on new evidence all the time. They're doing the home visits. And I think they're a great resource that I would love to be able to connect to, as kind of SASH as a whole, to get guidance from them, like on a regular basis, like every couple weeks or every, month or something, where we can just feel good about our protocols. Because I don't feel like, VDH is going to offer us that, so I feel like home health would be a good place to connect with. And then, is your team looking to you for guidance? Sometimes I do feel like sometimes I'm surprised that, well, when I came on site for the first time, there were no face shields being used or even ready to be used, and I made that a priority because I knew some people didn't wear masks, and I just wanted to have that ready. And there was a coordinator who was like, "Oh, I don't need a face shield. You don't need to get me one." And I said, "Well, I'd really strongly recommend that you have one and use it when someone can't wear a mask." And I don't know if they will, but I do think I try to offer that without being too pushy or anything. But so I'd say sometimes and sometimes not. And that's about it.
Hey, thank you, Sarah. And I do appreciate what you're saying about the home health policies. We have gotten policies mostly from our wellness nurses who have shared them with me because they also work for home health, and we have adopted a lot of those. But having a more formal process so that we know when they're changed or when they're updated would be really, really useful. We do run into, sorry, my dogs are joining us. It would be really useful to learn about them. We do run into the ability to have, I mean, we just don't have the same equipment in some instances, and that's certainly a challenge. And the ability for some employers to get it is a challenge, but it would certainly be nice to know what they're recommending so that we can work on that and try to get those supplies that we need.
Yeah, and I know that when I checked, it was probably like at least a month ago now, with our local home health, they were actually for all clinical and non-clinical staff recommending a face shield for visits, which that, I don't know if that's changed, but I was surprised to learn that. And one thing I just wanted to add too, as far as supplies, I'm wondering if there's, I think maybe I emailed you, Casey, but the hand sanitizer, I don't know if that's something that we can get through, Cathedral Square or not, but definitely that and the disinfectant are things that I think a nurse should be like able to carry with them all the time too. And if there's any
absolutely.
face shields, like face shields that are not reusable, or maybe more face shields, I've already feel like mine's potentially gonna get worn out pretty soon.
Yeah, absolutely. I'm sure that we can get hand sanitizer through Cathedral Square. I know that they do have a supply of that. And
Okay, I can reach out to me.
Yeah, I would encourage you to reach out to them. I know that currently the biggest shortage is gloves, but with the surge in cases around the country, there are again shortages of all of this equipment.
Yeah.
So, and we don't want to stockpile it and hoard it when other places need it, but at the same time, we do want to make sure we have enough. So, make sure that there is some system at your panels for tracking burn rate. We've talked about that on the last couple of COVID calls, so that when you go to make a request of the Department of Health for more PPE supplies, you can clearly say this is how fast we're burning through our supplies, and that would be really, really helpful.
Okay, yeah.
All right, thanks, Sarah. Jenna, you able to join us?
Hi, everyone. Can you hear me okay?
We can hear you. Go ahead, Jenna.
Okay, great. Yeah, things are going pretty well for our 3 panels, and I work with 2 SASH coordinators. And mostly, we connect by phone or email. Occasionally, we've been at the same building site, but we're not in like the same office. I've been doing a lot of my visits outside if it's possible. Sometimes I've been going in more and more and doing more in-person visits. So sometimes that is in their home, in their apartment or house. And I think one thing just to bring up so I don't forget was I'm just wondering, one of my questions actually is about equipment, about N95 respirators, and if we will be getting some in terms of, I think for me, just knowing that I don't have even just one respirator that fits correctly, it would be great just to have 1 or 2 on hand. So I'm just wondering, I know there's a shortage and it's been hard to get equipment. It's just kind of wondering where that's at. And in terms of deaths, we've had a couple deaths. Don't believe that that's due necessarily to, the lack of healthcare access or COVID-19. As far as we know, we've not had any positive COVID-19 cases. What I am seeing is just in terms of the mental health piece, just participants that, have been reporting just feeling more anxious, stressed, not necessarily knowing how to cope well, during this time. So just giving that extra support and also really encouraging them and helping with care coordination to receive services that they do need, and just following up closely with them. There's been, also reports. I have a few participants where there's been issues within like their family system with what's going on, people that have lost family members due to COVID-19. So it's just been, just more heightened in that area. But we are encouraging. A lot of participants are getting more care and reaching out, going to appointments, also just getting different procedures done that they need, and kind of doing that now versus, waiting until fall or winter. So that's really good to see. And in terms of using nursing judgment, so I feel that I have good judgment as a nurse and confidence in that. I think, though, during this time, it's an unprecedented time. This is new for all of us. It's just been really important to keep receiving education, being informed, reaching out, collaborating with other professionals. It's hard right now, and also just the uncertainty, with COVID-19. And I do feel that I'm able to assess, in terms of my own risk and risk to participants. However, again, just with some uncertainty and also not necessarily feeling that like having all the proper personal protective equipment that might be needed in different scenarios. So that's why I brought up the N95 respirators. I have been wearing mostly just a surgical mask with a face shield, as well as gloves when I go to see participants. And I have started to, I've been meeting people and loaning out the blood pressure monitors and the pulse oximeters, giving, educational pamphlets, and just will be following up with them closely. And participants are really grateful to have that equipment. So I think that's really nice that we have those. And with more guidance, I think it's always good to have guidance, whether more or less. I don't know. I think just, continuing to be informed is really important. I've just also decided personally that, I've been tested twice voluntarily for COVID-19. I'm trying to do that, ever so often if I can. The pop-up sites have been pretty booked out for a while, but I just feel that that's really important, especially going in more to see participants. And in terms of my team, looking to me for guidance, I'm in communication with them. They will reach out with questions when they have it. And this was quite a few months ago, kind of at the start of with COVID-19. I did a training for staff just on transmission-based precautions and use of PPE, which I thought was really good to do. And, anytime someone has a question, I'm happy to talk with them or kind of lead them in the right direction if I'm not quite sure about the question, about the answer. So I think it just continues to be a collaborative effort, at this time, and just staying in close contact with participants and really know what's going on for them. And I think going in, you just get a really good idea of what's happening for them. So I think that's mostly it.
Okay, thanks, Jenna. I did want to ask what you have tried as far as getting an N95 mask. I know that Shauna was reaching out for you to VBH. Did you ever hear anything back from them? And I'm not sure if other nurses have gone through that same issue, if other people have them, and if they've been fit tested. If other people want to chat that in, that would be great.
Yeah, I've not heard anything back. I know Christine Hazard, the executive director at Brattleboro Housing Partnership, she was looking into it as well. I know that can be, so I don't know the ins and outs. I haven't heard back about that. So I thought I would ask it today and then try to just get in contact with her again, about where things are at. And I wasn't quite sure just in terms of, within SASH or at Cathedral Square, if there are any other, answers to that, or if that they would be, giving more out at some point.
My understanding with that is that we can request at any time. Whether or not they will fulfill that request, I don't know. That's going to depend on supply and what other requests are coming in. So I think it would be really useful for all the nurses to have one and to have one fit tested, so that if there is a big surge in our community, we can continue to, as safely as we can, visit people. I really worry about nurses disappearing from one-on-one visits in the in the fall and in the winter, and having those for that purpose. Not that we would ever necessarily visit somebody with COVID, but as the risk increases, some nurses may feel like they need to take that step. There's also, so I will look into it. I know there was at least one other nurse who was having the same concerns, and I don't know if she was able to solve that or not. So I'll reach out to her and check to see if she made any progress, and I can let you know.
Okay, thank you. Yeah, I would appreciate that. And I think just because it's hard to know what, when we're in this time right now, just being able to receive even just one or two, or three N95 respirators that do fit, it's just a way that, knowing that we'll have something, for later on, instead of waiting till, later in fall or winter, and, will we be able to actually get that equipment at that time? So thank you for doing that.
Sure. Yeah, I will email you and let you know what I can find out. Kathy Taylor, are you able to join us on the phone?
Hi, everyone. I am working. Can you hear me?
Yes, we can hear you. Go ahead.
Okay. I'm working with my coordinator right now to still catch up on our assessments. And we are, as of yesterday, caught up. There have not been any deaths, but there's one situation that I feel kind of badly about. We went in last week to see a couple who have numerous medical problems. It is a somewhat abusive relationship, so that oftentimes they're not willing to share or open up to us. But when we left, we both looked at each other and said, she doesn't look well. And if I had said something to her, she would have poo-pooed me, because he would have come back and said something. So didn't she end up in the hospital 48 hours later with pneumonia? And I'm kicking myself on that one, but I'm not sure I could have intervened and done much for them. Rebecca and I talk a lot about our risk, and are we really able to should we be out as much as we are? So we have decided to cut back a little bit, and she will continue with her phone calls, and she's always good about getting back to me if someone needs a call from me. We will continue to go out and visit people that we feel are at risk or who might need or ask for a nurse and a coordinator visit. We always go out together. We never go out alone. And that brings up the question of how confident are you in your judgment? I do feel that I missed the boat on that gal, and I should have probably said something about contacting her PCP, but I did not. And that's a lesson for the future for me. So that's how we're doing. I have a wonderful coordinator, and she's really good about getting in touch with me. So I don't have any concerns right now about our panel.
Great, thank you, Kathy. It's been a lot is talk in the media around the concerns, or especially in abusive families. I mean, most of the talk has been about children, but certainly all forms of abuse, just with the increased stress and the increase of people being cooped up together, there's more and more risk there for problems. So thank you for bringing that up.
Well, we have several couples that are there's an abusive relationship there, and it's very concerning to me. So we're trying to stay on top of it and make sure that there isn't more going on during this time.
Yeah, have you found at all that phone calls become more private in those cases? Whereas if you had a visit, they would both be there. On a phone, you may be able to talk to them one at a time.
Well, Rebecca has had an instance, in fact, this week, where she really would have liked to have been able to ask more questions, but she was not able to. The husband was sitting right there beside her. So that's why we've talked about this, and we want to be more on top of it and at least check in with them more frequently if we can.
Yeah, great. Yeah, I think that's the best you can do, and being aware of it. I also wanted to ask, are you guys traveling together? How are you handling, I know you do your visits together, how are you handling transportation? Are you carpooling, and how do you deal with that with distancing? And
We've always carpooled, and we don't wear our masks, and we probably should, but the darn heat lately, if we can get a break in the car with air conditioning without our masks, that's what we've been doing. Last week we weren't out at all together. This week we were out yesterday for 2 assessments, and tomorrow we're going to make a call on someone that we're really concerned about.
yeah, one of the a couple of people have asked, how do we handle the panel where you do just that, where you're traveling together all the time, and and I know some folks have said, well, we're in each other's germ bubble, and other people are both wearing masks, have the windows all open, have the air conditioner going. I mean, I guess if you're spending the whole day together, that's kind of a different situation. So and again, this is around your judgment and your coordinator's judgment and what works best for the two of you. So thank you for sharing all of that. Kathy Schuster was able to text in. She's in Townsend, and she and her coordinator email a text or phone call, and they've done some social distance visits, but they're not sharing an office at this time. Let's see. Negative collateral damage, the loss of social contact with family and friends. Folks have expressed new onset of panic attacks and anxiety, reluctant to have referrals for help for behavioral health services. Participants not calling providers and counselors because they're not wanting telehealth visits if face-to-face is not offered. I think there is, I think that's a good point, that Kathy, about people being hesitant around telehealth. I think once people try it, a lot of folks are okay with it, as long as it's successful that first time, which obviously using Zoom the first time is not always a successful experience. So that's definitely a place we can step in and help if you're able to, so that those first few televisits are successful. But Kathy also says we've had several deaths which appear unrelated to COVID. Coordinator and I communicate regarding the readiness and phased in activities locally. Jenna has been helpful to bounce off situations and suggestions for steps and guidance. I would ask local providers for guidance on any participant and try to obtain monthly COVID testing at a pop-up site as available. N95 mask was fit tested at, I assume that's Brattleboro Medical, but I'm not sure. The question is where to get more, as this is not a standard mask distributed, but she has one. On-site visits are case by case, as many as needed. Great. All right, so thank you, Kathy. Any other issues or concerns that people want to bring up? We have about 10 minutes of time left, and we can certainly end early. I think that in addition to the comments on nursing judgment, I want to acknowledge that there are so many different factors as we're assessing risk, looking at how much spread there is going on locally, whether not really knowing how much exposure your participant has had, and then your own exposures. People have a varying degrees of exposure themselves. I know I heard a few days ago that at one panel, they are at the beginning of each meeting assessing their own risk from their own personal activities. So did you go to a rock concert? Then you're at higher risk. Did you, have you been hanging out with a huge group of friends, and kind of gauging their own risks that way, which I thought was an interesting exercise, interesting thing to be thinking about. We have some information on that we'll share on Monday on the COVID call, just thinking about our own personal risk and what are we bringing as a risk to our participants based on our own personal behaviors and our personal choices. I don't see any hands raised. I don't see any more questions in the chat. So I'm going to stay on for another 5 minutes if people have more things they think of or want to say. But otherwise, I'll give you a few minutes back in your day. Thanks so much, everybody.